Good afternoon. This is Dr. John Bennett broadcasting from Miami Beach, the studio of 3D printing in medicine. Today we have the pleasure of having Bruno Gobbato MD. He's an orthopedist from Brazil, and he's going to tell you a little bit more about his background. But he's going to talk today about an exciting area of medicine, 3D printing. And Bruno has a liking for using this technology in orthopedics. So welcome, Bruno.
Welcome, John. Hi. I'm glad to be here. Thank you again for inviting me. It's a pleasure. It's the second time, and I'm always following your post on Facebook and always learning with your new platform. It's a pleasure to be here on a very Sunday day. So thank you for the invitation again.
Yeah, it's a Father's Day in Brazil, right?
Yes, it's Father's Day. So, but we are here with very enjoyment.
Thanks for your dedication. Can you tell us a little bit about your background, Bruno, in orthopedics and how you got into 3D printing, please?
Of course, John. I'm orthopedic surgeon. I'm actually a shoulder and elbow surgeon. So you're going to see in my lecture my experience. So my experience is in shoulder and elbow. In the last webinar we did the shoulder version. And now for this webinar, we are going to focus more on elbow pathologies in orthopedic surgeons. So it's going to be a more dedicated presentation. I work as an orthopedic surgeon. I'm also a professor in the medical school here. It's Estácio de Sá University here. And also, John, the director for IT, technology for my Brazilian Society of Orthopedic Association. So I'm into technology since I remember myself. I really like these new technologies, and 3D printing I started on 2013, my experience in orthopedic 3D printing.
Okay, so what was it about 3D that interested you? Was it the mechanical part of it, working with your hands, or what was it?
John, what interested it was the planning, actually. It was not to have the pieces in my hand. The 3D printing was interesting, but the most interesting part is to plan the surgery. That was amazed me when I saw. My interest in 3D printing was not to have the anatomy in my hands, but to have tools to perform the surgery better. So what amazed me in 3D printing was to develop new tools, develop new techniques and new tools to perform some techniques, and then print them at my home, for example, to perform specific cases. And then, of course, learning about the technology, we saw that how important is to us as surgeons to know the anatomy better. Because when we don't have 3D printing, we think we know the anatomy. We are, oh, I know everything. But after you have that patient anatomy in your hand, your mind changes. You know, it for me was mind blowing. My knowledge of anatomy and biomechanical behavior, even for example, in fractures, even the fracture pattern, this all changed how I look, how I could look using the 3D printing models. Then I was just looking in the patient, and I was thinking, I was knowing that what to do, but most of the time I was just replicating or just using the automatic like in airplane, we are playing the automatic automatic pilot, actually.
The autopilot.
I think, yes, the autopilot, yeah, sorry. Thank you. I think as surgeons, I was using only the autopilot to perform my surgery. And when I start using 3D printing, I start understanding each surgery, each patient much better, and thinking what I was going to do, and not just autopilot and do the surgery, just replicating what I have seen in my teachers and replicating in my patients. I was actually knowing what to do. This might be so, you know, uh, not real, but once you understand that, it changes your mind.
Yeah, certainly an orthopedic surgeon, neurosurgeon, they have to know their anatomy cold. But from the patient's point of view, patients must really appreciate the medical education part where you can show them what pathology you have as well as what you want to do.
Yes, of course, for patient is sometimes almost like a gift, you know, to have their anatomy. But what's very important to us as patient education is to show exactly what we've done, what we're going to do, and what are the problems we may have, we may encounter, and what are even the plan A and plan B for some surgeries. So that's very interesting, and sometimes it's interesting even to convince the patient that that problem is really a problem. For example, a fracture, it's a very displaced fracture, for example, that he really has a problem, and it's not just X-ray diagnostic that the surgeon just is going to look at the X-ray in his office and just perform a surgery. The surgeon is preparing for that surgery, is analyzing that deformity or that fracture, and planning actually what to do and what's the best for that patient, for that case, and for that time.
Yeah, certainly as a doctor, you must know that when a patient understands what's going on, it's easier for them to follow your post-op instructions because they understand why they're doing what they're doing, and it's not a mystery.
Yes, and they understand why to perform a surgery or why to not perform a surgery. There's so many times we 3D print fractures, and I say, oh, this does not need to a surgery. For example, a clavicle fracture, I show, oh, this is a little displaced, but there's not shorting, very little displaced. You don't need a surgery. Sometimes the patient asks for surgery, and I show them, oh, this doesn't require a surgeon. You can live with that deformity. And the other part is to show how we are going to perform the surgery, how wide will be the exposure, and which implant. So the patient knows he's going to use a plate, he's going to use the size of the plate, the type of the plate. He doesn't have he doesn't have new information. All that is going to be performed with him is already known. You already explained to him.
Okay, Bruno, do you want to go on to your presentation of today, please?
Yes, let's start. Just a second. Okay.
Perfect.
Okay, so I'm going to present myself again just a little. My name is Bruno Gobbato. I'm talking from Jaraguá do Sul. It's a very small city in the south part of Brazil. Here we have my email in the in the inferior corner. My email is bgobato@gmail.com. Whoever has doubts or want to know about, you can email me. So I have already introduced myself, a shoulder and elbow specialist. I'm the IT director of the Brazilian Orthopedic Society. I work in the board director. I'm the scientific director of my state orthopedic society, and I'm a professor of medical school here in my city. I have no disclosure for this presentation, and I'm working in 3D printing since 2013. I was also an app developer since 2010, but this developing is coding for me is not more a reality. I'm going to show some personal experience. In this presentation, I focused on elbow lesions, but I'm going to just show a very simple example of a clavicle. This is more like a historical slide. This was, I think, my first case I used for selecting the implant for a clavicle fracture. Here you can see we have different types of implants for the patient. We have different types of shapes of this plate. And I used 3D printing to select the best fitting implant for my patient. This was one of my first cases. I think it was on last 2013, early 2014. Now, what we do, we plan all the surgeries using regular CAD softwares, as you can see here. So prior to the surgery, we know exactly which implant we're going to use, where every screw we're going to place, every size of each screw. And sometimes we develop some tools to help us place the implant in the correct and optimal position. This is a picture for some guides we attach to the fracture and tell us exactly where to drill. This picture was shown in an AAOS meeting on 2016. And here we can see that using this technology, we can do we can do a small approach because we know exactly where the plate is in all the position in the clavicle, and we don't need to use, for example, fluoroscopy, X-ray during the surgery, because we know exactly what we are doing because we have planned and we have the 3D printing. And here are some examples. This is a clavicle. This is a left clavicle fracture. This is the same clavicle fracture. We have removed the fragments and we have 3D printed using the screw holes to exactly know where each screw should be placed. And here we have this case. Here is an example of one of the guides. And another example we're going to show is the humeral fracture, proximal humeral fracture, shoulder fractures. Here we can see the diaphysis. Here we can see the proximal part of the humerus. And this is why I think it's so important, because this is the approach, this is the range of view you can see in proximal humeral fractures. So during surgery, this is what we see, and this is the field of view we have in the approach. We don't know if this bone is rotated, is inclinated. So 3D printing gives us this kind of spatial location. And for example, this is a very non-example of a fracture where we can, for example, select the optimal implant. This is a shoulder arthroplasty, a partial shoulder arthroplasty. In this case, we could select the best fitting implant, but the most important part is the height of the implant to be exactly to be the exactly anatomy of the patient. Now I'm going to show some elbow cases. This is a forearm osteotomy. This patient had a ulnar fracture with a mal-displaced or misdisplaced fracture. You can see here in the image. And we have planned the surgery. Here we have, using our CAD software, we're going to overlay the normal anatomy to the affected anatomy. We can see that we have here a 17 degrees of displacement. And now we are planning the surgery. We place the ostomy plan. We plan the surgery, putting the plate in the best position. And now we can develop some tools, some patient-specific guide. This is a very small guide, you can see here. We can see the affected side and the normal side. It's a ulna. And the guides that are going to fit on the ulnar. And we are going to show me where to cut the bone and where to place the screws. And the magic is that when I cut the bone and put the plate, the anatomy will be automatically reduced to the optional position, to the regular position. Here I can have the same case. As you can see, this is the deformity, and this is the regular anatomy where we can see. Another example, olecranon osteotomy. Olecranon is this part of the ulna, the proximal part of the ulna. Here we are showing how to plan a olecranon osteotomy. Here we can see the CAD vision. So we placed the two screws or the two K wires, as you can see here, and the plan of the osteotomy. And in a very simple way, we could produce a simple guide that shows exactly where to place the two screws to be exactly parallel to each other and exactly plane for the osteotomy. Here is another example of a ulnar osteotomy for radiohead posterior dislocation. This is a patient that has a radiohead posterior dislocation. As you can see here in the picture, the radiohead should be pointing to the center of the capitellum, and it's not. It's pointing backwards, pointing posterior. So we have planned a ulnar osteotomy in order to place this radiohead anterior. Here I'm going to show a video. We calculate this osteotomy using a regular CAD software, and we perform the osteotomy using guides and using 3D printing. In this case, we use 3D printing to analyze this deformity and to check if everything were done correctly. This is another example for elbow lesion. This is a posterolateral elbow instability. The patient that has elbow dislocation or elbow subluxation, as you can see here. So in this case, we did not know if the patient has a bone deficiency or it was only a ligamentous deficient. It's only soft tissue. We know for sure that this patient had instability in his elbow. This was a teenage, so we are not sure if we had just one deformity. So we performed the 3D printing, as you can see on the right, the elbow. In the middle, you can see that the elbow is dislocated, the radial head is subluxated, the ulnar part is subluxated. Then we have performed the reducing the fragments in the computer, as you can see here. And in the image in the left side, you can see that this elbow is dislocated. So here we can see a better view. This was what 3D printing first helped us to know this is a problem. This is a low resolution 3D printing because this was not used for surgery, this was just for test. And then we performed a better printing to see that there was no bone deficiency. We have done the 3D printing, and we checked that this elbow could fit well with no problems. Sorry about the audio. And we could check that this patient had only a smooth part, ligamentous deficient. We did not need to correct the bone part. This is an example of a cubital varus. Cubital varus is an elbow deformity. The patient has an internal deformity of the elbow. This was a proof of concept. So we have here in the image a normal elbow, a normal distal humerus part, and a affected. This patient had a varum of 20 degrees, a 15 degrees of extension, so posterior dislocation, and 10 degrees of internal rotation. So here we have performed the 3D printing. This is the affected elbow, as you can see here. So this image is interesting us to understand the whole anatomy of the elbow. And then we performed the correction in the surgery. We used the regular side as a reference. We mirrored both sides to understand the deformities, just what we're going to do just right now. So now we are mirroring. We can see that this patient has a very big deformity. Now we are going to plan where to correct. So we're going to do a lateral cutting, as you can see here, cutting edge. This is the plane we're going to cut. We are performing the cut of the lateral part and performing the correction of the deformity in all the planes, varum, extension, and rotation. And by doing that, we develop a guide. A guide is a piece of plastic that will fit on the lateral part of the humerus. We are going to see in the next image to help us directly correct this deformity. So here we see in the upper part, the elbow and the guide, and in the image, the guide. The guide shows us exactly the two cutting locations for the osteotomy, and the two locations for placing K-wires proximally and distally. And then we have performed another guide in order to check if the correction is done. Other examples for shoulder, in this case, this is a lateral G procedure. It's a procedure we do for shoulder instability. We have performed. Guides we performed. So we create guides to show us the exact location to place screws, for example, in the coracoid process, guides for the glenoid part of the shoulder to place screws in the correct position, not to be too medial and not to be too lateral, and to be exactly parallel to each other. Here, an example of using a guide. It's just like a plier that hold the bone, and now we can use to drill the exact position. Here is another example of the guide. As you can see, that's a very simple guide that can help us in surgery. Very small and simple guides to help surgeons perform better surgeries. Here is an example for shoulder. This is a glenoid, a scapula. This patient has some deformity. This patient has a posterior deformity of the glenoid and also a inferior problem in the glenoid. So 3D printing can help us identify some problems in the patient's anatomy. These are two different patients which have very bad glenoids for surgery. If the surgeon doesn't look for that, doesn't understand the deformity, the surgery won't do well. So these are some other examples of 3D printing. This is a guide from a company called Turnier. We printed their guide, but we create our own guides using our own softwares. These are some guides we have performed for many surgeries, and we can create any guide, any type of guide, of any shape of guide we want, as you can see here, because we have the freedom to create our own guides with our own different shapes in order to perform better the surgery. Here are some other examples for 3D printing, other guides used in surgery. Another interesting subject is to plan grafts. Some deformities cannot be corrected only using the implant. We have to use graft. In this case, we planned the exactly graft for replicating the patient anatomy. In this video, you can see our plan, which is in red, and the graft in 3D printed. This graft are going to be in surgery. The surgeon will look for this graft and use bone, autologous or cadaver bone, to replicate exactly the anatomy. To do this without this tool is more like a feeling and not like exactly performing the correction this patient deserves. So I'm ending my lecture. I think that today MRI and CT are the exams for today. These are the exams we are using, but tomorrow and in very near future, I think 3D printing will be in every small business, every small clinic, every small hospital. Just a second. We are working also with new technologies. We are using mixed reality, augmented reality to help us in some surgery. I'm not going to show the whole video. I'm going to show here. This patient had a deformity in the clavicle. He has a rotational deformity in the clavicle, as you can see here in the 3D printing. This we are using HoloLens, virtual and augmented reality glass, and to understand the deformity, the patient is placed as it was in our office, in front of us. We placed him just in front of us, and now we are going around the patient to understand all the deformity, all the anatomy. We can look inside the anatomy, as you can see here. We're looking from the front, we're looking from the back of the patient, and now in surgery. The surgery was transmitted live, including for John, and here we are using the 3D printing technologies and the augmented reality to help us correct the best fitting rotation for this patient. And our next field of study is robotics. This robot we have just finished printing and assembling. I'm just now have to code him and maybe teach him some techniques for shoulder and elbow surgeries. And maybe, John, in some days or in some weeks, we could share with you some robotics knowledge as well. So thank you for being here. Thank you for watching this webinar. I'm very glad to be here and sharing us what we are doing here in our country.
Yeah, excellent, Bruno. Well illustrated, great videos and pictures to an exciting part of medicine. And you're obviously excited and passionate about this. And I'm sure it's kind of like get your career maybe off to another jump start. Not that you needed it, but I mean, I know for me, discovering technology has been the rebirth of my passion for medicine. You know, of course, I'm older than you, but it's going to give me a way to participate in medicine in my older years, really, because all I need is a computer. Now, as far as 3D printing, what percentage of your practice do you actually do the 3D printing in?
Yeah, that's a very nice. John, as a shoulder surgeon, I work mainly with tendons. I work mainly with rotator cuffs lesion. So I don't use for my daily surgeries. The 3D printing because I work with smooth parts. But all my bone surgeries, and I'm talking about fractures or bone problems or bone deficiencies, I use 3D printing. Before entering here alive, I was printing. I have here, it's not, I have 2 clavicle fractures to correct this week. They are already planned, and then I just ended printing my guides for these clavicle fractures. They were just done before we went live. Mm-hmm. So every bone or every fracture I use. Of course, as I work in private practice, I don't have a lot of fractures to perform. If I had to perform 10, 20 fractures a week, I couldn't do that alone. But as I have a limited number of patients, all my patients goes to 3D printing when I need a CT scan. Mm-hmm. When a lesion doesn't require a CT scan, of course, I don't do the 3D printing. But nowadays, John, I use CT as it's a very it's a tool that is very important, not only for 3D printing, but to understanding the anatomy. So almost every patient I perform surgery, I 3D print. Okay, I know you're talking about elbow today, but hip surgery is so common. Now, do you do 3D printing for hip surgery? And is there a demand amongst your fellow orthopedists to say, hey, Bruno, I want a 3D rendering of my patient's joint? Yes, I think it's the same problem. As hip surgeries are so much common, my colleagues doesn't require printing all their patients because they don't have time, and I wouldn't have time for printing for them. Right. But of course, for deformities, for lesions that are away from their expected anatomy, we perform for hip and for knee deformities as well. Mm-hmm. As you say, as hip surgery are very common everywhere in the US and Brazil, there's a very wide field for 3D printing. But when a deformity or a lesion is too common, sometimes this kind of technology that are in the cutting edge of the technology, we find some difficulty asking the surgeon or convincing the surgeon to use. And I understand, because they perform so many surgeries that they actually they should have, but they don't have time for analyzing the 3D printing anatomy before surgery. But they should spend some time using 3D printing for every surgery, I think.
Well, as you know, probably Brazil is like the United States. Reimbursement is a consideration. Is that reimbursable costs of surgery, or no? Not yet.
No,
not yet.
No, not yet.
Not yet. Okay. Okay. I'm sure that's a question that keeps surgeons from looking into it until it gets reimbursed.
Yes.
Yeah.
But it's not high cost technology, John.
Okay.
When an implant here in Brazil would cost maybe a good implant would cost something like $5,000 to $10,000. Okay, a hip implant. A 3D printing model wouldn't cost more than $200, $300.
Okay. That's a relatively minor cost.
Yes, it's a fraction of the cost of the surgery. It's a very small fraction of the cost of the surgery. You know, it's just a regulatory problem. Of course, it's another cost. It's going to add some cost for the insurance, for the patient, for anyone. It's going to add some time cost for the surgeon as well. I understand that. But in a whole medical cost, I think it's so small. It's a so small cost in the whole bill of the patient that I'm not sure why it's not used more or it's not used regularly. I don't have this answer.
Okay. Now you are a rarity probably in orthopedics that uses 3D printing. Do a lot of hospitals have orthopedists that maybe have a little hobby, or do you don't see many?
John, I think there are very few surgeons using. I know some of them here in Brazil. I know some of them in the world. We have a very small community. We use Facebook, we use LinkedIn. We almost know each other. When some surgeon in France, when some surgeon in Italy, and when I have actually a colleague here in Brazil that goes in a surgeon in Italy that going to fellow in Italy and France, in a 3D printing service, they all know me because this is a very small community. So I know we are so much close community yet. But I think what we're going to change, John, our children will ask to have 3D printers at home. Our children will ask to build toys for them. Our children will build their own toys and will ask us as fathers to 3D print and to help them 3D print. And then when this happen, and it will happen in the next 5 to 7 years, I think this will be abroad, will be used in mainly everywhere.
Yeah, well, we had a conference in 3D printing in medicine, and we had a few people from orthopedics, mostly in the research end. It's I think the population that really it should appeal to, and I talked to a hospital administrator about this, is that you better get ready to 3D print a lot of your hospital goods. And I'm not talking medical. I'm just talking, in the room, because it's a revolution in industry, probably even more so than medicine. I mean, it's going to affect the way that a lot of things, everyday things are built. And you're just going to need a printer. You're not going to need a factory.
Yes. And we are printing tools, John. We are not printing. What fascinates me 3D printing is not printing the model. The model helps us, but what fascinates me is to print the tools to perform some surgeries. And the tools that I create, I have the creativity to create tools. That's what brings freedom to everyone. So the tools, as you're seeing, I have so many small tools here at my home that I had.
As you built yourself, huh?
Yeah, that I did myself, and I have fixed myself using my printers, you know.
Wow, that's great. Well, okay, I won't keep you all day. I know it's a Sunday, Father's Day, and I hope you go to your family and enjoy the day. And I appreciate talking about the topic on such an area of expertise, and we welcome you. Any idea you have, we'd be glad to go online and televise it. So
Thank you, John. Thank you. It's a pleasure to be here again. I leave open here my email that was in my presentation. Everyone who has doubt can go to internetmedicine.com and find our post, can find your post on Facebook, can find me through your post, or can find directly me. I have a very active social media, but I use LinkedIn. So everyone who wants to follow my research, just search for my name in LinkedIn. I will be very glad to share.
well, you can screen share anything you want to screen share now. I'm going to screen share right now, Bruno, the page that your talk will be archived. So let me see here. Okay, your talk will be archived. Can you see the page?
Yes.
Okay, it'll be archived on the 3D Printing and Medicine Studio, which is at internetmedicine.com. Just follow the menu directions.
Perfect.
And also Bruno's talk will be archived here. And as you see, we have Bruno's talk from a while back we archived.
That's nice.
And we also have contact info for you, Bruno, over here, as well as on the website. And did you want to show us something?
No, John, I think everything is
okay. Contact info, yeah, contact.
Yeah, in your website, it's
great,
just fine.
Well, super. I'll sign off officially, Bruno. Just hang around just for a second. We'll chat.
Okay.
So thank you very much.